She has acted in many plays and serials. Her passion is in singing, dancing. Also, she is a painter, and their list is unending. She has acted in many shows like Kyo Utte Dil Chhod Aaye. Upcoming web series are like Durash on Amazon Prime. She has acted in Sasural Simar Ka on Colors TV, which was most popular show. She is recipient of awards like Colors Golden Petal Award, Perfect Woman Award, Bharat Icon Award, Dadasaheb Phalke India TV Award for Best Actress, APJ Abdul Kalam Bharat Puraskar in 2021, Blissful India Best TV Icon in the year 2021. I welcome you, ma'am, and we are really fortunate to have you as a chief guest today. And in a short notice, you have accepted the invitation in your busy schedule. Ma'am, I invite you for your words of wisdom, please. Ma'am, please unmute yourself, ma'am.
Can you hear me?
Yeah, now we can.
Yeah. Thank you so much, everyone, for inviting me to the CME, and it's a pleasure. It's an honor to be here in front of so many dignitaries. Yes, I have acted in. You must have seen me in TV. काफी doctors जो है वो कम देखते हैं TV, but I don't know whether you all have seen me on TV or not. Your families must have seen definitely. Dr. Sachin, thank you so much. Special thanks to you for inviting me here. And I was asked my opinion and some tips regarding dressing up and other tips for doctors. So if you have any question in particular, you can ask me, or then I can share my experience with my doctors or something like that.
Ma'am, you share with your experience, and along with, if there are questions, I'll address it to you.
Okay. Okay, so I think there are set standards for doctors dressing up. It should be subtle, it should be sober, it should be appealing, it shouldn't be much revealing. Should be the dressing up for, especially for female doctors. Whenever I visit my dermat, she is so welcoming, and apart from her subtle dressing up, her attitude is also so welcoming and so pleasing. So that is what attracts me to her. And I'll share my experience ki mujhe, whatever I like in my dermat. So whenever I visit her, she's very gentle, and of course whoever I have seen a general standard for dermats and for other doctors. Even my sister, she's a doctor, Dr. Amrita Samar. She's in California. So even like I see overall dressing up of the doctors, it's very sober and simple, and that should be the way, is what I feel. Because if it is very loud, or if something is there which is very distracting or loud, I think it is something which will turn the patient off. बिकॉज आई थिंक डॉक्टर्स का जो इम्प्रेशन होता है सोसाइटी में, वो एक अलग इम्प्रेशन होता है. दे आर ट्रीटेड लाइक नेक्स्ट टू गॉड, एंड आई थिंक पेशेंट्स की कुछ एक्सपेक्टेशंस होती है डॉक्टर्स से, and dressing is the like something which is a physical appearance which should be soothing, which is what I feel. Of course, it should be according to the fashion standards, today's trends, jo bhi hote hain, they can be followed. But as I said, it shouldn't be very loud. The makeup shouldn't be very loud. Like हमारा जो camera makeup होता है, like we put it on screen, it is loud. Whenever we will do that makeup and we go out, it will be loud for the general public. But for the camera, it is okay, because camera needs it. And like I said, ki doctors, there is something called nude makeup. And in today market, cosmetics are very lots of cosmetics are available which you can put something. What I said is nude makeup, the makeup which we put on, but ऐसा लगता है कि makeup नहीं है. So that is one makeup which should be followed, not only by the doctors, also by everyone, day makeup shouldn't be very loud. Of course, if you're going to a party or something, then you can make your makeup a little bit loud. It will, it's not a distraction and it looks good. So whatever suits you, you can follow that. Whatever dressing suits you, you can follow that. And one more thing I would like to say that doctors जो होते हैं वो idols होते हैं patients के लिए. So patient as a patient, मैं जब अपने डॉक्टर को विजिट करती हूँ, मैं हमेशा एक्सपेक्ट करती हूँ that she should be fit. बिकॉज जब डॉक्टर्स प्रिस्क्राइब करते हैं दैट आप डाइट के लिए आपने ये करना चाहिए, आपने स्किन केयर के लिए ये करना चाहिए, हेयर लॉस के लिए करना चाहिए, तो पेशेंट्स आर वेरी क्लेवर. उनकी नजर जाती है कि डॉक्टर्स हिमसेल्फ और हरसेल्फ आर फिट और नॉट, उनके बाल अच्छे हैं या नहीं, उनकी स्किन अच्छी है या नहीं, ये नजर जरूर पेशेंट्स की भी जाती है. सो आई थिंक डॉक्टर्स आजकल तो सारे डॉक्टर्स भी फिट है एंड दे शुड बी फिट, क्योंकि अगर आप किसी को प्रीच कर रहे हो तो वो पहले आपने प्रैक्टिस भी करना चाहिए, ऐसा मुझे लगता है. सो या दैट इज ऑल आई वुड लाइक टू शेयर विथ यू ऑल. और मुझे लगता है ये सारी चीजें बहुत इंपॉर्टेंट है फॉलो करने के लिए.
Thank you, Shweta, for your kind words. And can you just, as you said, can you just tell how a person should decide about what dress suits her or him?
See, as I told you that for doctors or for generally, are you asking?
General, I am asking, general.
Okay. So I think according to your height, your personality, your body structure, if you are short, if you are plump, then I think so you should not wear the clothes, very light clothes, because dark clothes make you look slimmer. And जो हम कहते हैं हॉरिजॉन्टल लाइंस वगैरह वो सब ध्यान रखना चाहिए, हॉरिजॉन्टल वर्टिकल लाइंस, बिकॉज दैट आल्सो कैन मेक यू लुक स्लिमर और फैट. और I think it is also a matter of personal choice. Whatever you feel like wearing, and you should try it on, and if it suits you, you feel it suits you, I think you can go for it. I personally don't believe in much revealing clothes. Being in the industry also, I have my set limitations, and I personally, I don't like to wear much revealing clothes. But if you can carry it well, of course, you can go for it. It's a matter of personal choice, as I told you. My favorite color is black, which I'm wearing right now. And I like all the colors. Of course, that also is a personal choice. Whichever color you feel suits you, you should wear. Darker people can wear light colors like peach, pastels, all those colors suit darker people. And the fair population, they can wear all the colors actually.
Yeah. Thank you so much. We were really, actually, this is today's virtual meet. Otherwise, we would have overwhelmed to meet you personally. Mostly post-COVID, we can plan to meet you personally if it is.
Sure, ma'am. It will be a pleasure.
Yeah, it will our pleasure rather than yours.
Thank you so much.
So I thank you for joining us. I just to appreciate, I would request Piyush to give a digital memento to Miss Shweta Sinha.
Only one thing has come up in the COVID, that you don't have too much choices of the clothes, particularly
Yes.
for the doctors. Whatever the hospital gives, he wears right from morning to the evening. That's the thing which has come up.
Very true.
And many people like it.
That's true.
Yeah.
Sir has pointed out.
Thank you for the memento. It's lovely. And thank you. It's a lovely honor to be with you all. A pleasure talking to you all. Thank you.
Thank you. Thank you so much.
Thank you so much, Shweta.
Thank you.
Now, I request Sushma ma'am, Chairman IMA AMS, to preside over the CME.
Okay, thank you, Ragini. So, good evening to all. On behalf of Indian Medical Association Nagpur branch, PDS and NOGS, I welcome you all. Indian Medical Association Nagpur branch has organized CME on updates in dermatology in association with Vidarbha Dermatology Society, the Nagpur Obstetric and Gynecological Society. So in this particular CME, there will be 4 speeches by eminent speakers from dermatology, and at the end of the 4th speech, there will be the question and answer session. So as we all know that some dermatologists focus on medical issues and dangers related to the skin, and others choose to concentrate on aesthetic issues and cosmetic application of the dermatology. Cosmetic dermatology is a subspecialty of the dermatology, and practitioners undergo additional training. So a cosmetic dermatologist may work at dermatology clinic, general practitioner, or medical spas. So instead of addressing patients' needs, they address patient desires, performing services like correcting skin tone, smoothing the wrinkles, then removing the hair on the face and body, reducing the surface fat, tightening skin, removing tattoos, treating cellulitis, treating acne and acne scars. So, considering the need of the day, IMA also selected this important topic for the CME. And with this, I wish all the best to all the speaker and chairperson of today's CME. Thank you so much. And I welcome all you again. Ragini, over. Ragini, you are mute.
Thank you, ma'am. Now I request our IMA President Devtare sir for his welcome address. Devtare sir?
Yes. Am I audible?
Yes, sir.
Today's chief guest, beautiful, smart, talented Miss Shweta Sinha, the famous TV actress, smart, handsome, and beautiful speakers. Also the chairpersons, conveners, uh, President of Dermatology Society, Dr. Deepak Shirbate sir, President of NOGS, Dr. Alka Mukherjee madam, who herself is a fashion icon for all of us. Today's MMC observer, a smart looking Rizwan Haq sir, equally handsome and beautiful audience. Everyone, he or she wants to look handsome or beautiful, and doctors are not exception for this. But due to our busy schedule, we are unable to give adequate time for making up more handsome and beautiful. I am sure that today's CME will not only help us, but others to make handsome or beautiful with limited resources and time which we are having. So after the CME is over, start using the tricks for yourself and also for others to become more smarter. So I can go behind the screen with a share. सपनों की दुनिया में हम होते चले गए, सपनों की दुनिया में हम होते चले गए, मदोश ना थे पर मदोश ना थे पर मदोश होते चले गए, सपनों की दुनिया में हम खोते चले गए, मदोश ना थे पर मदोश होते चले गए, न जाने क्या बात थी उनके चेहरे में, न जाने क्या बात थी उनके चेहरे में, न चाहते हुए भी उनके होते चले गए, उनके होते चले गए. जय हिंद, जय IMA Nagpur. Thank you very much.
Thank you, sir. It was a great start by IMA President with a beautiful lines. Now I request and invite Dr. Deepak Shirbate sir, who is President of Vidarbha Dermatological Society, who accepted to be part of the CMA in spite of his busy schedule. Sir, are you there? Dr. Shirbate?
Am I audible or not?
Sir, you are audible now. Can you please?
Okay, that's yeah.
We
Good.
need words of wisdom from you as a
Yeah, sure.
dermatologist.
In fact, good evening to everyone who are attending this that important scientific session. First thing, I appreciate the words and address from the today's chief guest, Miss Sinha. She has addressed the very important issue, which will help to create the good relation between patient and doctor, that and give a good impact of doctor on the society also. And thanks for that kind word from today's chief guest. Secondly, it's our pleasure to have a scientific session with our parent body, that is IMA. IMA is our parent body. Everything comes under our Indian Medical Association. So it's our pleasure to have this scientific session with IMA, AMS Nagpur, and Obstetric Gynecology Society of Nagpur. On behalf of the Vidarbha Dermatology Society, which takes part in every scientific session which is related to awareness program, social program, or social awareness program, or even the anti-cockery programs. So we are very happy to have this session with IMA and IMAMS and Obs Gynec Society of Nagpur. On behalf of VDS and all this, I welcome today's chief guest, Ms. Sinha, today's eminent speaker, today's panelist, organizer, today's convener. I warmly welcome all of them on this important scientific session. You see, cosmetology is a sort of emerging branch. It is a sub branch of dermatology, but it is very emerging branch. It need to have further exploration, and to need this further exploration, we have the topmost eminent speaker with us. We have good panelist, and I'm sure this will help to clear our doubts and to make our cosmetology practice more effective and more beneficial to the patient. With this, I express my sincere thanks to Dr. Sanjay Devtari sir, Dr. Sachin, for giving this opportunity to conduct this scientific session with IMA. I also express my sincere thanks to today's convener, IMA AMS, Obs Gynec Society of Nagpur, and all of you to give we are given this opportunity to conduct this program. I wish all the best for this scientific session, and I hope it will help us to create the good knowledge and to create the good practice as far as the cosmetology is concerned. Jai Hind, Jai IMA, Jai VDS. Thank you very much.
Thank you, sir. Thank you for your kind words of wisdom. I request Piyush to hand over the virtual memento to Dr. Deepak Shirbhate, sir. Hello, DG
Ma'am,
Piyush.
just a minute. Ma'am, there seems to be an issue, a technical error while sharing the screen.
Okay.
Just give me a moment.
Yeah, no issues. You take your time, no problem. Is this sorted, Chirag?
Otherwise, no issue.
Sir, you be there.
No issue. We can.
We'll hand over.
We can proceed further. No.
Yeah.
Okay. No,
yeah.
we can proceed further. No problem.
Yeah. The technical issues.
No, madam. We can proceed further. At last, we will see. No issue.
Yeah.
I'm going to attend the whole program. Don't worry.
Yeah.
I will
Thank
be
you
there
so
till
much.
end. Yeah, sure. Thank you.
So thank you so much, sir. Thank you so much.
Proceed further, no issue.
Yeah.
Yeah.
Now I invite Dr. Alka Mukherjee, who is president of Nagpur Obstetric Gynec Society and our own friend, for her words of wisdom on the today's CME.
Thank you, Master
Ma'am,
of
the
Ceremony. Am I audible, Ragini?
Yes, yes, ma'am.
Respected Chief Guest, Shweta Madam, gorgeous Shweta Madam, who pointed out the right things about doctors, what she likes or what she dislikes. IMA President Sanjay Devtare sir, IMA Secretary Dr. Gathe, Vice VDS President Deepak Shirbhate sir, Dr. Sushma, Dr. Ragini, all the respected members of three societies and my dear friends. It gives me immense pleasure to welcome you all for this important CME, a joint venture of IMA along with NOGS and Dermatological Society of Nagpur. The first topic is communication
Excuse
skills, which
me,
is a backbone
Alka
for the...
ma'am.
Yes.
Chirag, please mute Shirbhate sir mic.
Yeah.
I have done.
So friends, the first topic is communication skills, and which is a backbone for a successful professional life. And more the efforts put in, the more it is rewarding. The second topic is skin care. Because of pollution and faulty lifestyle, we all are facing many problems with our skin. And it's the appropriate time when to take the care of skin appropriately decided by the IMA team. The third topic is grooming and dressing sense. Of course, a person's dressing sense says a much about that person, and who want to mess up with the golden chance of clicking a deal while in the first visit itself with the patients. So again, I welcome all the speakers, all the chairpersons, the master of ceremony. I thank IMA for associating us. I thank VDS for associating us. Wish you all happy learning. Thank you so much. Over to you, master of ceremony.
Ragini, you're mute.
Thank you, Alka ma'am, for your kind words. Now we proceed for the CME. I invite Dr. Anshul Jain, who is a chairperson for today's CME. Dr. Anshul Jain. She is a director, a Pearl Skin and Hair Laser Center, Nagpur. She is ex-senior consultant Kaya Skin Clinic, ex-consultant BLCC Health Center. Special areas of interest is anti-aging procedures, dermal fillers, thread lift, Botox. Done extensive thesis on ultra-thin skin grafting on vitiligo, member of IADVL Media Cell, 2021, presented many papers and posters in national and state conferences. I welcome you.
Ragini, before that, we will have to vote of thanks.
Yeah. And before we start with the CME, I invite our Honorable Secretary Sachin Gate to propose vote of thanks for this CME.
Thank you, Ragini ma'am. So thanks for giving me opportunity. Before starting lecture, usually we give at the end, so no one attend that. So on behalf of Indian Medical Association Nagpur branch, in association with Vidarbha Dermatological Society and the Nagpur Obstetric and Gynecology Society, today's CME on updates in dermatology. So a very good, very important topics we are going to discuss in this CME, and on this occasion we have got a very gorgeous, beautiful our very own Dr. Miss Shweta Sinha. She's from Nagpur only. She is my batchmate, elder sister. So thank you for your kind words, tips for grooming, and definitely we will welcome once you come to Nagpur whenever. So you are welcome to the IMA Nagpur anytime. I would like to thank VDS President Dr. Deepak Shirbhate sir for guiding us. Also, I'm grateful to our NOGS President Dr. Alka Mukherjee ma'am, and I thank you and all the best to all the speakers. Dr. Asim Sharma sir from the Mumbai Dr. Rupa Artiya ma'am, Dr. Priyanka Magia ma'am, and Snehal Giratkar. They are going to discuss on the topic from right from the soft skill, how to speak with this patient, face contouring, wrinkle, lines, common problem with adult acne, melasma, and the last topic is grooming and dressing. And last but not the least, our two convener, Dr. Sushma Thakre madam and Dr. Ragini madam, who has taken all the efforts to arrange, organize, to conduct this CME. Also, I would like to thank our MMC observer, a dermatologist, Dr. Rizwan Haq sir, our eminent, our delegates who are joining and who are going to listen to this CMEs, and our technical support from DigiShield. Thank you very much. Chirag, please display our annual conference NIMACON 21 flyer. I, on the behalf of Indian Medical Association Nagpur branch, request you all doctors to please register for this a very important annual conference of Nagpur IMA branch, NIMACON 2021, which will be held on 19, 20, 21st of November. There will be a various subject will be discussed of all the stream of medical professions. So please register for it and enjoy the annual conference. So I end with this. Thank you very much, and I will request our convener to proceed with the CME. I forgot to mention our chairperson, Dr. Anshul Jain. Sorry. So thank you, Dr. Anshul Jain, for chairing the session. You have to chair for all the 4 speakers. So all the best.
Thank you.
Dr. Anshul Jain, ma'am. Just hello. Unmute yourself.
Yeah, ma'am.
Ma'am, the sequence of speakers, a bit change in that. Dr. Priyanka will be the first speaker. Second will be Snehal Giradkar, followed by Dr. Asim sir and Dr. Rupa Artiya. Kindly note this.
Yeah, sure. Yeah.
So now you can continue with the CME proceedings. I welcome you for this, ma'am.
Yeah. Thank you, Ragini ma'am. Thank you, team IMA, Sanjay Devtare sir, Honorary Secretary Sachin, Dr. Sachin, VDS President Dr. Deepak Shidwate sir, and NOGS President Dr. Alka ma'am, to give me a pleasure, and I'm humbled to be the chairperson of this session. So without now we'll proceed for the today's CME. So the first topic for today's CME is by Dr. Priyanka Magia. So I would like to invite Dr. Priyanka Magia for her topic. Over to you, Priyanka. Priyanka?
Yeah,
Dr.
thank you,
Priyanka.
Anshul. Yeah, thank you, Anshul. Yeah, good evening, everyone. Myself, Dr. Priyanka Magia, dermatologist and cosmetologist, working in Nagpur. Thank you, IMA, for giving me this chance to speak on the very common topics which are now seen in a very uncommon age group. So my topic is common problems in the uncommon age group. So without wasting much of the time, I would like to start my presentation. Am I audible? My voice is fully audible?
Yes, ma'am. Yes.
Yes. Okay. I'm sharing my screen now.
Yeah.
Is the screen visible? Hello?
Yes, Priyanka. Yes, Priyanka, it is.
It is visible.
Ma'am, is it in the full screen? It's on
It
full
is
No,
not
screen?
full screen.
No,
It is not
it's
full
not
screen.
full screen.
Ma'am, you'll have to download either it, or if you have option to direct present it, you can go for that.
I'm joining from iPad.
Right, ma'am. So you're opening the presentation through mail, right?
Right.
Okay, so you can just
So
simply
you want me
download
to,
it. Yep.
or you want me to add it to the home screen, or
Right,
I
ma'am.
paste it in Zoom? Shall I paste it in the Zoom?
No, ma'am. It's completely all right. We can see it right now, but if you can download this presentation and then present, it would be on the full screen move.
I'll just see. Okay.
Yeah.
The delegates can put their questions in the chat box, which will be answered at the end of the CME.
Yeah. Is it okay now?
Yeah, absolutely.
Yeah,
Yeah.
Yeah.
Myself, Dr. Priyanka Magia, as I have introduced myself earlier, and this is my short CV. Now, coming to my topic, which is common problems in uncommon age group. Why this topic and why this label? This is because initially in early days, it was usually seen that certain skin disorders were common in certain age groups, like the acne were common in the teenage groups, whereas the pigmentation or melasma was common in the age group, elder age group, like above 40. But in recent times, this line of demarcation has vanished and it has lightened. And now we can see the acne problems in an elder age group of 30, 40s, and 50s, whereas the pigmentation problem has now become common in the younger age group as young as 25. So that is why this topic is being selected. Okay, now coming to the list of the problems. First is the adult acne, melasma, fine lines or rhytides, and wrinkles. I'll be speaking only on adult acne and melasma, as the rest of the two topics will be covered by Dr. Rupa ma'am. So starting with my first topic is the adult acne. By definition, adult acne go as the adult acne are acne occurring after the age of 25. They are also known as adult onset acne. Now, there are various contributing factors. We all know that acne is a multifactorial state. Not a single factor is responsible for causing the acne. Many a times, the acne are caused by the variety of the causes. So here is a list of some of the factors responsible for the acne. First and foremost is the fluctuating hormonal levels, which are usually seen around the menses, pregnancy, perimenopausal, menopausal, or after discontinuation of the birth control pills. Second factor is stress, which we all know is very high in day-to-day's life, and in Corona period, because of the home work from home, the stress level has increased. Other factors to go ahead is with family history. It is usually seen that the children of the parents who are having the acne in their family do suffer from a severe form of acne. So we can say that the acne are having a genetic predisposition. In today's world, because of the extensive advertisement and the media use of the cosmetics, there is a tendency of the people to use the cosmetics without any consultation or without they are OTC products anyways, and they are available over the counter, and so people go and pick them up. Many of these cosmetic products have got the bee wax or the oil base, which clog your pores and cause the acne. So if the cosmetics are used for a longer duration, like in the hour wise or in the days wise, it definitely leads to the formation of acne. Other factor is as a side effect of many medications. In recent times, there was a rampant use of the steroids, and post COVID, or you may say as even when the COVID was going on, because of the rampant use of the steroids, we had to face, or dermatologists face, this problem of the steroid-induced acne. Apart from steroids, certain anti-tuberculosis drugs and many other drugs are responsible for the formation of acne. Certain undiagnosed medical conditions like PCOS, hypothyroidism, etc., are also responsible for the acne. Now, coming to the pathophysiology, one can see that this is a normal skin. The upper layer is the skin. Can I get a pointer? Will I be able to point it? Hello? Fine. So,
Yes.
ma'am, pointer नाही येणार ना याच्यावर?
नाही.
Okay, fine. So one can see that the above layer is the epidermis, and the black color which is going inside is the hair follicle, and जो ऐसा तिरछा फिरछा लग रहा है, zigzag लग रहा है, that is all the epidermis, and below that level is the dermis. One can see that the hair follicle is extending from the dermis to epidermis, and right hand side में जो अलग सा structure दिख रहा है, that is the sebaceous gland, which is responsible for the production of the sebum. One can see that the sebaceous gland is attached to the hair follicle, and therefore this unit is known as pilosebaceous unit. Now the sebum, which is produced by the sebaceous glands, always move onto the surface along with the hair follicle. So the hair follicle and the hair opening, whenever they get clogged with the increased keratin production or increased cellular debris, they get blocked, they get clogged, and therefore it leads to the formation of whiteheads or open comedones, whiteheads or the blackheads. Now, as the follicle or as the hair, opening gets clogged, the sebum gland, sebaceous gland is producing the sebum, and because of this, the sebum gets accumulated in the epidermis or in the dermis, and this leads to the formation of comedones, which are in two forms. One is closed or white comedones, and the other one is open or black comedones. The black color is nothing but the Tyndall effect because of the sunlight. Now, if this secretion goes on increasing, there are Propionobacterium acnes. They are the bacteria which are the normal inhabitant of the hair follicle. They start proliferating and they will initiate the immune response, and this results in the inflammation, and ultimately it leads to the formation of papules or pustules. As in the last picture, one can see if this inflammation goes unchecked, it leads to the rupture of the follicle, and there will be more and more accumulation and more proliferation, and this will lead to the formation of cysts and nodules, and if they burst, they lead to the scarring. Now, coming to the topic, treatment part, the treatment depends upon the severity of the acne. It can be either topical, it can be oral and topical, and many a times we have to combine the procedures in the form of peels or needling of the comedones, and even have to use the lasers. Now, coming to the topical, in topical, many a times only clindamycin, adapalene, benzoyl peroxide, or the combination of these topicals are used to treat the acne. But if the severity is more, and if the acne are of grade 2 and grade 3, there are different types of acne, and if the number of acne and the size of the acne are also more, then in that case we need to go for oral antibiotics, which can be either doxycycline, limecycline, or azithromycin, or if it is in the form of cyst or nodule, if they're quite bigger, very big and very painful, in that case, we give isotretinoin, which is the vitamin A derivative retinoids. Apart from this, if we are facing some kinds of limitations, like if the patient is unable to tolerate the antibiotics, or if the patient, we cannot give isotretinoins for some or the other reasons like the deranged lipid profiles or LFTs, in that case, we need to add the procedures in the form of peels. Peels are nothing but the chemical solutions which we apply on the face, and which are the combination of glycolic acid and salicylic acid, or the combination of both. Now, these peels, especially the glycolic acid or the salicylic acids, they usually shrink the sebaceous gland and thus control the sebum and ultimately the acne. It is been seen that the comedones, which are either white or black, they are ineffective to the treatment. They are non-responsive to the treatment. In that case, we need to needle them out, where we just give a nick and scoop them out. Now, nowadays lasers are also being used for the treatment of acne, because it is seen that the intense pulse light, that is IPL, they have their effect on the Propionibacterium acne. They control their proliferation, and simultaneously they also have their effect on the erythema. So they are increasingly used for the treatment of acne and post-acne erythema or redness. Now, here are certain do's and don'ts for the person who are suffering from the acne should follow. First to go ahead is with do's. One has to wash your face 2 to 3 times a day. One has to keep it dry and oil-free. By keeping oil-free doesn't mean that the patient has to keep on washing the face every half an hour. Person has to wash the face 2 to 3 times a day with face wash, and remaining in between, if he is feeling very oily, he can wash it with the plain water and dab it with the dry and very clean towel. A person suffering from the acne should always use non-comedogenic unmedicated products. In today's cosmetics, many cosmetics have written non-comedogenic on them, but they actually are not non-comedogenic. So before using any cosmetics, please do consult the dermatologist. One has to use the clean towel or napkin to wipe the face. Simply because if you are suffering with the acne, and if you are sharing your towels and napkins with everyone, the bacteria and the other germs or other microorganisms which are there on other face, they get transferred to your face and may develop your infection. Drink plenty of water, at least 7 to 8 glasses of the water has to be done by that. Eat lots of salads and fruits every day. We all know that the salads and fruits are the rich source of the antioxidants and the radicals and anti-inflammatory. So eating fruits and salads not only keep the zits away, but also it hydrates your skin and gives a glow to your face. The last one is for the one who has to use the makeup regularly and for the long term. Persons who are in the profession where they have to use the makeup, where they don't have any option, they need to clean their brushes regularly, because the brushes serve as a very good medium for the development of the microorganisms. And if you are frequently using them without washing them, you may develop zits. Now, coming to don'ts, the first and foremost is don't pick your acne. The person who has acne, the papules, nodules, or cysts, they are not supposed to pick them. They are not supposed to prick or burst them in any kind, simply because it will lead to the scarring. And always remember, once a scar is always a scar. It can be modified, but it cannot lead to the complete cure. So never pick your acne. Today, people, because of the OTC products, are using very steroid-based creams such as Betnovate and Panderm. Now, these creams, they have top super potent steroids like clobetasol, and they not only cause the acne, but if they are used for a long term, they will definitely cause the skin atrophy and also the telangiectasias, which are the very fine blood vessels in your skin. Third is don't go for the home remedies like neem, multani mitti, because these are all the drying agents. And if your skin becomes dry, if your barrier system is damaged, you will suffer from more acne and more severe form of acne. One should not use cosmetics for a very long term. And one should not oil the hair and sleep overnight simply because the oil will dribble along with the hair on your face and will lead to the clogging of your follicle and lead to the acne. Now, it's being stated that there is a certain role of diet and acne. So, yes, there is a strong role. The foodstuffs with a high glycemic index increases the serum insulin concentration and thereby increases the sebum production and ultimately the acne. Whereas it has been found that the foods with the low glycemic index, it reduces the free circulating androgens responsible for the acne and thereby it reduces the acne severity. Very important to notice, no food causes or cures acne. There is no such food or any other drink which say this there will be a complete cure of acne. No, neither the food causes or cures the acne, but yes, it can certainly ameliorate, can certainly increase or decrease or worsen the severity. Now, my next topic to go ahead is with melasma. By definition, melasma is an acquired, circumscribed pigmentary disorder which is more or less symmetrically distributed and having a geographic borders and affecting only sun-kissed areas. It can be seen on cheeks, forehead, upper lip, and temples. Now, coming to the idiopathogenesis, the factors which are responsible for causing melasma is mainly the sunlight. The cumulative effect of the sunlight, which we faces over the years, is responsible for the causing of melasma. Apart from that, genetic, which also plays a role in the melasma. In today's cosmetics, as the cosmetic industry does not have a very stringent rule, what they write on the ingredient, they don't put it, and what they put, they don't write on the ingredient part. So there are certain toxic ingredients which are there in the cosmetics, and if we use them for the long term, they definitely damage our skin and will cause the melasma. Next is the drugs. Certain drugs like phenytoin, hydroxyurea, even the chemo drugs, they are responsible for the pigmentation on the skin. Hormonal imbalances, definitely the oral contraceptives, pregnancy, endocrine dysfunctions, they are also responsible for the formation for the melasma. Now, coming to the pathogenesis, before going to the exact pathogenesis, I would like to say that the normal physiology that the color of the skin is because of the melanin. Now, the more darker shade of the skin has more production or more amount of the melanin, whereas the lighter shade of the skin has less amount of melanin. And this melanin is produced in our body by the cells called as melanocytes, which are in the skin. Now, in melasma, there is increase in number and the activity of melanocytes in epidermis. So the number of the melanocytes has also increased in the epidermis and also the activity. So the melanin is produced in a larger amount. Now, apart from the epidermis, there are certain changes which is also seen in the dermis, which is the next layer to the epidermis. In dermis, there is increase in the activity of fibroblasts and also the number of blood vessels. And because of this, the patients who are suffering from melasma or any kind of pigmentation, if you see them very carefully, you will find an erythema or a ring of redness around their melasma. This is because of the increase in the number of blood vessels. Now, coming to the treatment part, the treatment of melasma can be either oral, topical, procedures like deep peels, intralesional injections, and certain lasers. So, coming to the oral medication, first is the ascorbic acid. Ascorbic acid is antioxidant and anti-radical properties, and thus it reduces the melanin production. Next is the tranexamic acid, which usually is not of our not our molecule, not the dermatologist molecule, because it mainly controls the bleeding disorders, and it has an anticholinergic activity. But in recent time, research has shown that it decreases the alpha melanocyte stimulating hormones, which stimulates the melanocytes and thereby increases the melanin synthesis. So tranexamic acid, it decreases this hormone and it thereby decreases the melanin synthesis. It also decreases the number of blood vessels in the dermis. So in short, it has an anti-angiogenic effect as well. So it reduces the erythema, which is associated with the melasma. Next to go ahead is the zinc. We all know zinc has antioxidant, anti-inflammatory, and immunomodulatory effects. Now, coming to the topical, the first and foremost thing is the Klingman's formula, which is usually used as a first-line therapy, which is nothing but the combination of hydroquinone, retinoic acid, and the corticosteroids. Now, the hydroquinone itself has the potential, if used for the long, has the potential to cause the deep dermal pigmentation, which is also known as uchronosis. And this pigmentation doesn't go away. And apart from that, corticosteroid, as I told, that steroid, if used for the long term, can cause acne. So this formula or this topical application has certain limitation. It can be used only to 6 to 8 weeks, and later on we need to stop it to reduce the side effects. So after, if it is being stopped, then the other topicals, other depigmenting creams come in role, which are kojic acid, glycolic acid, arbutin, glycorice extract, azelaic acid, glutathione, tranexamic acid, retinoids, silymarin, mequinol, niacinamides, and flavonoids, and they are available in various combinations. And they are, of course, less potent as compared to the Klingman's formula, but they are effective and they are to be used for a long term. Now, coming to the procedures, many a times we all know that the melasma is very difficult to treat, and the single therapy or the monotherapy doesn't work. In that case, we need to add the procedures, which is in the form of peels. Again, the peels are like glycolic acid, lactic acid, trichloroacetic acid, retinoid peel, salicylic acid. These peels are available in different percentage, and according to that percentage, their depth of penetration differs. So some of them, if they are used in combination and is lesser percentage, are termed as superficial peels. And some peels like the retinoid peels, they are the deeper peels, which actually causes the peeling of your skin, visible peeling, where patient can see as if the skin is coming out. And they are known as a deeper peels. Apart from peels, we can also go ahead with the intradermal tranexamic acid. The simple tranexamic acid injections are being injected into the skin, and it has to be done weekly for almost 8 to 12 weeks. And the latest is the lasers, especially the Q-switch NDAC lasers, which has to be tried on monthly basis for 4 to 6 sessions. Now, India is a country of sunlight, and sun is a very gigantic powerhouse of the energy, but at the same time, it has a very deleterious effect on skin, and it is responsible for the aggravation of the hyperpigmentary disorders and malignancies. So, photoprotection is very important in India, not only to prevent the pigmentary disorders, but also to prevent the malignancies and the future degradation of your skin, like collagen degradation, which leads to the wrinkling and the pigmentation. So one has to use photoprotection, which is very, very important in Indian skin, because in India, we never tend to protect our skin from the early age, and later on we face these problems. So for the protection, these are some general or certain general measures that has to be used by one. In India, it is not possible to avoid the sun, but as much as one can avoid, please avoid it. And especially between 10 a.m. to 4 p.m., simply because the sun rays are perpendicular during that time and they contains a lot of energy, especially in our area, in Vidarbha area, where the mercury soars like anything and the temperature is like it will burst out any day. So we have to avoid the sun as much as possible. One has to wear the broad spectrum sunscreen, which includes the physical as well as the chemical sunscreen. So it has to be broad spectrum. Other thing is, one should wear broad hats or broad brim goggles, scarves, dupatta whenever they are going out. So it is not like you have to use either of them, either the sunscreen or either the broad hats or scarves. No, it has to be combined. One has to apply the sunscreen on the face and on the hands or on the exposed area whenever they are moving out. On the top of it, they have to cover it with the hats, scarves, dupatta, whatever is possible. And even for that matter, for the hands, gloves in Vidarbha area. Whenever we are out, we should keep it to shade. And we have to avoid the scented cosmetics and wet wipes simply because they have the potent photosensitizers in them. Which will sensitize your skin and will make it more photosensitive. Now, nowadays, whenever we go to buy any cosmetic or any sunscreen, be cosmetics or medicated, we see this terminology SPF 30, 50, 60, 100, or not. What is SPF? SPF is nothing but sun protection factor. It tells how much longer the skin covered with the sunscreen takes to burn as compared to unprotected skin. This is, in simple, it is the skin which is covered with sunscreen will take long to burn as compared to the skin which is unprotected. But this is, the SPF is this major, which is the time, how much longer time the skin covered with sunscreen will take. Okay, so it is basically the ratio between the UVB, that is ultraviolet B radiation, which is required to produce the minimal erythema on this sun protected skin as compared to the same erythema which is produced on unprotected skin. So for an average Indian skin, the SPF of 30 or slightly more is enough to provide the good UV protection. Ideal amount of sunscreen which has to be applied is 2 milligram per centimeter square or 3 ml, or just more than half the teaspoon for each arm, face and neck, and 5 ml or more than 1 teaspoon for each leg, chest and back. So these are certain, I had tried to cover it in a short. I know the sunscreen topic is really out of this presentation, but I have tried to give as much as practical tips I can give it. And by saying so, I complete my presentation. Thank you.
Thank you, Priyanka. That was a lovely presentation. There are few questions which the audience would like to know.
Is it Anshul?
Yeah.
Anshul, your voice
want...
is not very clear. Anshul, your voice is not very clear.
Okay. Hello, am I audible now?
But it is not very loud. You need to be a little louder.
Okay. Am I audible now?
Now you're good.
Yeah. So, Priyanka, it was a very nice and very insightful presentation. Thank you for giving us so much insight regarding the acne and the pigmentation problem. Now, there are few questions which I would like to put on. So the one question is regarding pregnancy related melasma. So is the pregnancy related melasma permanent, or is there any chances of having that melasma every time if the patient is pregnant? Please do give your views on this.
The pregnancy related melasma usually tends to go away, but in majority of the cases it is being said that chloasma, which is actually the pregnancy related pigmentation, is known as chloasma. In majority of the cases, the chloasma turns into melasma, and even it is seen that even if it goes in the initial pregnancies, it tend to come back in the subsequent pregnancies, but it is not a rule. So it may come or it may not come, and the chloasma which turns into melasma is really difficult to go, but the chloasma, if it is there, it has a good prognosis.
Dr. Priyanka, your camera is not focused on your face. Can you just adjust it?
Mom, actually,
I'm not able to see you.
Even I am trying to focus my camera on myself, but I don't know, there's some issue and I'm unable to focus it on myself.
Okay.
Okay, one sec, ma'am. Yeah, now is it okay?
Yeah, now it's fine. Yeah.
Okay, yeah.
So, Dr. Priyanka, it was a very lucid and very informative talk, and very day-to-day life and questions you answered with your talk. At the end of the session, we would like to address few questions to you. So that time, we would request you to answer those queries.
Sure, ma'am.
Now, I request the DigiShield people to hand over the e-memento to the speaker, Dr. Priyanka Magia. Chirag, please hand over the e-memento.
Thank you.
Thank you, Dr. Priyanka.
Thank you, ma'am.
Yeah. Over to you, Dr. Anshul now.
Now I would like to invite Dr. Aseem Sharma.
And Dr. Anshul, your voice is not very clear.
Now I would like to invite Dr. Aseem Sharma. He is the director of Skin Saga. He practices in Mumbai and has done extensive work in soft skills and PRP therapy. So over to you, Dr. Aseem.
Thank you so much, Dr. Anshul, for the kind words. And at the outset, I'm very thankful to IMA Nagpur branch, NOGS, and Vidar Dermatological Society for inviting me. Now, the context has already been set about soft skills when, the chief guest for today, Ms. Shweta Sinha herself mentioned what qualities she looks for in a dermatologist. And if you were hearing her properly, not only being well dressed, obviously the words here are clean, neat, and conservative because we can't be too flashy as doctors. The second thing is about your body language, and the third thing is about how approachable you are. So I'm just starting with a small photo, which is of the same clinic where I practice, where you can see that my body language is open here. You can see that I have a pen in my hand, which means I'm trying to take notes and make a treatment plan for the patient. And you can see the patient smiling, and I am maintaining eye contact constantly with the patient. So in just a simple photograph, I've told you what I'm going to cover in the next few slides. I've been given a total time of 15 minutes. I'll try to finish as soon as possible. So as doctors, we're very fond of statistics, we're very fond of research. So what does research say? A survey which was conducted by the Harvard Business School, they localized or delineated 10 highly successful people, and they wanted to see what is the secret behind these people's success. They took parameters such as intelligence, education, good academics or great scores, a good family background, hereditary, family wealth, or somebody who comes from money, or simple hard work. And guess what? They found that none of the above were factors which were constant with each of the people they had selected to be successful. What they found was that the secret to successful people is all in the skills. And these skills, as you know, can be divided into hard skills and soft skills. So if you look at the definition, if you open Oxford after the presentation, you will find a very simple definition which says that soft skills are a cluster or a group of personal attributes that enable one person to interact effectively and harmoniously with other people. The keywords here are the keywords here are actually people. So these are people skills which enable you to interact more effectively and harmoniously with other people. So we all know about hard skills. To put it very simply, all our MDs, DNBs, our MBAs, every single education, graduate and postgraduate, all the degrees that we have, all the fellowships that we have, all the skills that we learn. Now, Dr. Sushma spoke about a wide gambit of things that we do as dermatologists, right? From dermal fillers to injectables to cosmetic surgeries to peels, lasers, clinical dermatology, dermatopathology. So all of these are hard skills when you're trained in this. Soft skills, unfortunately, are not tangible. So with hard skills, I can put them up at my clinic that I've done this thing from here, this thing from here. I've done a couple of degrees, a fellowship. I can measure that. That is tangible. But soft skills are not measurable. In fact, people abroad, corporate hospitals abroad now have started this questionnaire called a PQRS, or a physician question reassessment survey. What they basically try to do is they give this to patients to enable them to give feedback about doctors, how doctors work in person. And that not only covers hard skills, that covers soft skills as well. So just to break it up a little more, soft skills are people skills. The first and foremost skill there is communication. Leadership is not pertinent only to the patient, but also beyond that to your clinic staff, to your team if you're working in a corporate hospital, to your department if you're working in a government hospital. So leadership trickles down to all those things as well. How effectively you resolve conflicts, negotiation. We're consistently negotiating. I'm a third generation medico, and my mother kept telling me how you negotiate not only with your patients, not only with your team, not only with your hospital staff, with your HODs, with your dean, with your superintendents, with your association presidents and secretaries, but you negotiate with yourself every single day. And that is a very, very big part of how soft skills are developed. Empathy rather than sympathy. I'll be covering that in subsequent slides. And how quickly you can adapt. Now, adaptability is a soft skill which all of us have seen. We've stepped out of our comfort zone during the pandemic and telemedicine, even though it's been there for 20 years. 2001 is when the first draft for telemedicine was laid down. But when did we finally jump into the foray? In 2020, after the pandemic. So it took us 20 years to break that envelope and adapt ourselves to embracing technology. And I'm very proud to say that I was with a senior dermatologist from Maharashtra the other day, and beautifully he was managing the Zoom meeting and the patient call and the wherewithal, which means that we can adapt even at the age of 65, which is a great thing. Which means that soft skills can be acquired anytime. It is never too late to acquire soft skills. Now, as doctors, we are embodiments of dependability, reliability, adaptability, and respectfulness. But my question to you is simple: are these qualities enough as doctors? The answer obviously is no, otherwise we wouldn't be having a topic like this today. But there are a lot of my colleagues who say, I believe totally in my clinical acumen and diagnosis. I believe in my soft skills as well. That doesn't mean that hard skills can be compromised. Soft skills work only when you have good hard skills. So if you don't have good hard skills, soft skills are of absolutely no virtue. At the same time, I'm going to go out on a limb and say this, and a lot of people might not like it. Even if you have good hard skills but no soft skills, you will still be in the same boat. So you need a good combination of both. You need a combination of your brain, hard skills, and your heart, soft skills. So you need a combination of that to survive in today's day and age. Again, what do statistics say? So Harvard School of Public Health, and Harvard is very, very fond of conducting public health surveys. They're quite popular and very, very famous, and a lot of reads they get for all these surveys. So they had posted a question on Twitter: what makes a good doctor and how can we measure it? I'm going to pull up my pen for a minute. This is by far, I think, the most important slide I'm going to show to you today. So if you see empathy, soft skill; good listener, soft skill; compassionate, caring, kind, soft skill; humble, soft skill; competence is the first hard skill that comes. Only 6% of the patients who were asked depended on the doctor's competency. Determined, tenacious, soft skill; curious, inquisitive, soft skill; collaborative, soft skill; intelligent. So only 9%, which means out of the 100 patients who come to you, only 9 of them care about your hard skills. The other 91 will only listen to your hard skills if you also have the soft skills. So this, my friends, is the most important slide I'm going to display today. Please take note of it. Striking a balance between the head and the heart. I've already talked about this. What do patients feel? Now, all this has been talking about, research and surveys and what we feel as doctors, but what do patients feel? So all of you are aware of the Association of Medical Consultants. a very senior doctor from the Mumbai branch, had written this article in 2017 in the Times of India, where he's trying to give notes to patients, how patients should maximize their consultations, how they should get the best of their consultations with their doctors. And the patients are here encouraged to kind of ask if there are any doubts, to clarify again and again, to extend the consultation, to be honest about things, to not conceal medical evidence. And all of this, when you read the article put together, it talks more about soft skills of physicians than the hard skills. So that again is something which is very heartening. So I have told you about soft skills, why they are important, but what are these soft skills and how do I get them? I am just telling you about soft skills. I've never said that they are easy. They are absolutely not. You have to, especially those people like me who are from government colleges and from an armed forces background, you have to unlearn a lot of things that you learn and then learn and relearn and keep relearning till you reinforce soft skills. If you look at the corporate sector, soft skills include ethics, a positive attitude, teamwork, critical thinking, communication skills, and leadership. For doctors, the three most important skills are professionalism, which fortunately most of us have, dependability or reliability, and verbal communication. I think number three is what we lack the most. Communication is the wherewithal of soft skills. If there is, it's like the foundation. If you don't have good communication skills, everything else will topple over in due course of time. Obviously, for bigger clinics and bigger setups, it becomes easy because we also employ counselors now. So if you don't have the soft skills, you better outsource it. But soft skills have to be there, not only in you, but your front desk, your therapist, your clinic staff, your colleagues, your juniors and seniors. You all have to be in the same boat. One person with soft skills and 9 persons without it, or with bad soft skills, it's the same story all over again. Communication is one of the major. Now, why I've written major is because as physicians, we are all very fond of classifications. So my classifications are major soft skills and major soft skills. There are no minor soft skills. So the very first and the most important soft skill, like I've told you, is communication. Not only verbal communication between you and the patient, and between your staff and the patient, and your colleagues and the patient, also non-verbal communication, how you are dressed, which again, I'm sure Ms. Nehal is going to cover in the end. And I think Ms. Shweta threw a lot of light onto it beforehand as well, how to dress properly. Along with that, how you're sitting in a chair, whether you're facing the patient or not, whether your hands are folded or not. These are all things which, speak of body language, which I'll be covering in the next couple of slides. Written communication, again, has to be clear, and virtual communication. Now, I'm talking to you through the Zoom meeting, sitting in my clinic in Mumbai. If I stop looking at the camera and start looking only at the slides down, you will lose focus. You will not listen to what I'm trying to say. That itself shows us the importance of soft skills. You should be empathetic rather than sympathetic. I'm sure all of you know the difference. Empathy is when you can feel what the patient is feeling, and sympathy is only when you feel sorry for somebody. So you don't have to feel sorry for the patient. You actually have to put yourself in patient's shoes sometimes and feel what the patient is feeling. Leadership, I've spoken about it since the beginning. For team building, it has to trickle down. Your soft skills have to combine with the other people in your clinic or organization as well. Ethics, I'm not going to cover, is something which has been covered multiple times. There are in fact books on medical ethics. I'm not going to cover that today. Again, Shweta mentioned at the beginning that we have achieved this semi or demigod kind of status. She's absolutely right. We've been hailed as gods, put on a very high pedestal for a long time, but people are changing nowadays. Younger people are more aware of this fact that you have to be humble and respectful and not be egoistic. This is something which is changing very frequently. I think in another 10 years or so, with the kind of people, with the kind of Google information that's available, with the kind of options that people have, with the kind of maturity that people are, attaining, it's going to be very difficult for us to be, okay, I've said this, I'm right, end of discussion. There will always be a discussion on whatever you say. So we have to start taking it in our stride. Listening skills, again, very, very important. The patient has to understand that you're willing to know. Looking at your phone in between, looking, somewhere out of the window in between, these things don't really work. I'm sure all of you already do that. A receptive body language and being positive no matter what, even if you're breaking bad news to a patient, you still can give it a positive light. So there are ways and means of doing that. Your face is the index of your mind. It's very visible. Even with the mask, you will find people who you know are smiling and people who are frowning. You don't even need to see their lips to see what kind of facial expressions a person has, and COVID has taught us that. Your posture, your head motion, when you're nodding a little bit, patients also understand, okay, you're listening to a patient, so they can go on. Facial expression, eye contact, maintaining a constant gaze. And gestures, gestures like please go on or stop, or maybe a gentle touch. All of these things definitely do affect and are a part of soft skills as well. So if I were to mention communication again and again, this is the third time I'm mentioning it. If I can give you some tenets of effective communication, the first is fluency. You have to know how to put your point across in the minimum possible period of time. Luckily in Mumbai, we don't see more than 30 patients in a day, but I'm sure all of you who are in your OPDs right now, your OPDs are beyond 200 or 250 or 300. You need to be able to put your point across in a very short duration of time, very few words spoken. At the same time, you have to have that gap of silence in between where the patient can come in and talk to you about what you've been asking. Support, it always has to be a dialogue so that the patient ends up feeling satisfied. Open questions when you're taking, history and when you want the patient to open up. Closed questions when you know exactly what you want to ask the patient, or leading questions, has to be a combination of both. Please unlearn Hutchison and no leading questions in history. All of us ask that. For paucity of time, you have to ask leading questions. Elicit proper history, and your main method of communication or aim of communication is to establish a rapport with the patient. What are the other soft skills? The major ones that I spoke about: etiquette and mannerisms. Again, it's going to be covered right after this talk. Grooming. I have three very clear-cut dictums when it comes to male grooming. You have to be clean, you have to be neat, and you have to inspire confidence. You can't be flashy, but you can't be unkempt at the same time. It really matters a lot, especially in our field, which is dermatology. Expectation management is very important. Specifically for dermatology, you have to know when to put your foot down and say no. All those patients with body dysmorphophobia or unrealistic expectations, you have to be able to tell them no. Conflict resolution is an emergent skill. If you're able to tackle conflicts effectively in the office, you will be the go-to person, and you will be getting a lot more patients than you already are. So try to be that person and resolve conflicts as amicably as possible. How do you do that? By using soft skills. William Osler, and okay, so just to put things into perspective, soft skills are not a new concept at all. William Osler a century ago said, the good physician treats the disease, whereas the great physician treats the patient who has the disease. We are trying to treat the patient and not the disease. Hard skills will treat your disease, but only soft skills will treat your patient along with the disease. So for example, something like this is a very common joke in human resources departments. Okay, that looks like water coming out of her eyes. Sharp observation. Those are emotions. We're going to learn how to recognize them and do something about it. I'll give you 5 more reasons why soft skills will bail you out. Patient is king these days, and the patient is more aware and more armed. Armed could be with a weapon, just saying it in a very lighter sense. Obviously, it's very disturbing how patients are these days, but they can be armed with a lot more knowledge than you expect them to be. The competition is cutthroat. All of you know that very well. Legalities are very stringent. If somebody were to file a lawsuit, all of us fall under the Consumer Protection Act. All of you know that. If someone were to file a lawsuit against us, it is the onus is on us to disprove that. And perceived negligence is a new concept where even if you're not negligent as per the books, it could be perceived as negligence by a patient or relative. The stakeholders, which are your government, your administration and society, know only the rights but not the duties. So that's again somewhere where soft skills will help you out. And going viral is very easy today, especially if you've done something bad. All of us have heard about the dermatologist in Bangalore who got sued. You know how easily shit hits the ceiling, for lack of a better word. So that is again something where soft skills will definitely bail you out or reduce the damage. You have to deal with patients, irate relatives. From our demigod status, we're being reduced to sounding boards. And medicine as a profession has one of the highest stress indices. That is, obviously, this is a study which was done by IMA National, where more than 80% doctors in India are stressed out, not only because of the profession, but because they fear violence, they want security, and they're not able to sleep for a minimum of 7 hours in a day. So these are again a few cases where soft skills might just bail you out. Beyond patient care, again, this is beyond the gambit of today's presentation. I'm going to stick to only patient care, but just to tell you, soft skills also include your presentation skills, your negotiation skills, your teamwork skills, your inter and intrapersonal skills, time management, stress management, and teaching and education. Communication skills, again, I won't be covering each of them in detail, but just to show you the tenets of communication skills, the tenets of leadership, right from team building to giving feedback, interpersonal skills, right from networking to personal growth to introspection and office politics for that matter, creativity, and personal skills where you can, like I said, along with introspection, you have to know how to take criticism properly, maintain a good work-life balance, and continue to be ethical and enthusiastic in your practices. So the ancient Egyptians wrote, "Be skilled in speech and you will succeed. The tongue of a man is his sword, and effective speech is stronger than all forms of fighting." Obviously, I don't want you to do what is being done in the right side of the screen. But having said that, I'm glad IMA, invited me to talk about a topic which is a very, very offbeat topic, but something that I feel in the next decade will be something we'll be including in our medical curriculum, along with financial management and medical legal defense. I really think personality development and soft skills should be included in the medical curriculum. And we all have to move towards a concept called patientology, where you are more empathetic, you understand the patient's fears and worries, and you end up having a high emotional quotient to have a high emotional connect with your patients. So since we are, there are no takeaway points because you're not going anywhere. I'm from my clinic, I'm giving you this lecture. So stay home points. Soft skills are mandatory, not optional anymore. And in the near future, definitely not optional. You have to unlearn, learn, and relearn to pick up these skills effectively. Hard skills are useless minus soft skills. Minimal introspection will help you. See, all of us know these skills. You just need minimal implementation and a little mindfulness to be able to implement them. And your patients will in turn help your patients, which is nothing but patientology. Thank you very much for a patient hearing.
Thank you so much, Dr. Asim, for this wonderful presentation. We all got very enlightened regarding the soft skills and how to manage our patients and how to manage the complications which might be solved with our soft skills only. Thank you so much.
Thank you.
Now I request Chirag to hand over e-memento to Dr. Asim, sir. Thank you.
Thank you.
So there's one question which I would like to ask Dr. Asim. So in this COVID era, we as doctors and our patients as patients are feared regarding the cross infection, and we might get infected and they might get infected with us. So how come the soft skills and communication skills are going to help us fight this fear and overcome this fear?
Correct. So like I told you, we've all moved towards teledermatology, and that is again somewhere where soft skills do have a big role to play. Even through a small camera where I'm talking to you right now, you will be able to see if I'm interested in what you have to say, if I'm maintaining my gaze with you. All these few things, we can always be empathetic, even if it's over a simple phone call. We always do that with our parents. We can do the same thing with our patients as well.
Yeah, definitely.
Yeah.
Very enlightening. Thank you. Thank you so much.
Thank you so much. It was really lucid and informative talk. Thank you.
Thank you so much, Dr. Ragini. Thank you.
Now, I would like to invite our next speaker, Ms. Nehal Giridkar. She is a very grooming and makeup expert to talk about grooming and makeup in our day-to-day life. I would like to welcome Ms. Nehal Giridkar.
Hello, everyone. Greetings for the day. And I would really like to thank you, the entire team, to have me here today. And this is my first time ever sitting in between all the geeks and all the doctors. So it is like super, super great opportunity for me. Thank you so much. And before I would start, I would really like to thank you all the doctors. You are being a warrior in this pandemic time, and taking care of us in this situation is really appreciative, and really, really thank you. You are like the great warriors. Thank you so much. So yeah, now going towards my agenda today. So I won't be talking much about everything. I have, put up things in like little nutshells that will be like a key pointers whenever you in grooming. So first of all, we would I would like to go like, what do you mean by grooming? Like, for example, I would like to say, when we meet a person for the first time, the first thing we notice is how the person is dressed. So here where the grooming comes in picture. So this is the first thing, when we come across someone. So grooming, that's why grooming is very important. And so that is how you create an impression. So it can be your first impression, can be your last impression, or it can be your lasting impression. That is why grooming is very, very important for every one of us. So me being working in this fashion industry, I have come across, many fashion designers, and I've come across many people. So it always gives me a sense of motivation, like when I meet someone and how the person looks, I really feel very you make that little image about that person, because you don't know whether you're going to meet that person next. So that is why it is very important that how we dress up. So let me just have a quick brief talk, and this can be an interactive session also. So if anybody wants to stop me and ask me question, that will be easy, so that it will help me to take this little conversation in the right direction. So for example, when it comes to male grooming, there could be like 3-4 things that we should keep in mind. Is like the clean look. What do I mean by clean look? So your hair should be done, your beard should be like cleanly shaved, or if you have nowadays men, they are keen towards keeping beard, so it should be like well shaped and in well gelled manner. So the haircut should be taken on time. The next thing I would like to tell is like how to match your clothes. Like for example, you being doctor, you guys always wear aprons and all, but still you have to make sure you have a proper formal clothes. The few things that you should keep in your wardrobe would be like, not you should avoid is like to have flashy colors like yellows and oranges. And you can actually keep 3-4 main colors like blue, blacks, and white, which never goes out of fashion. You should always make sure that your belt and shoe is matching. This is where you can, look uniformed. So you have to take care of that. The third thing, it would be how do you smell. So keep it less, but yes, you have to make sure that we use a proper deodorants or proper scents, because most of the time, like me as a makeup artist also, I work very close to my clients, so I have to make sure how do I smell, I have to take care of my breath, everything. So these are the few personal hygiene things we have to maintain. And yeah, so these were the 3 things for men. And then for women, I would like to say, yes, we can, like we don't have time. If we are mothers, if we have to take care of the house, so we hardly give that time to dress up or to look good. We just run, like, because we have to wind up many things before we go to our workplace. So we have to give that little 15 minutes for ourselves. So what can we do? So we have to decide 2-3 good hairstyles that will suit us. Okay, we can have a clean, nicely tied hair. We can have a proper haircut. We have to make sure we have to keep away from the frizz. For that, we can use like proper serums, or we can use proper sprays that are available in the market. And so, as I said, less is more. We can always have that little makeup on. I will not tell you to spend like 20-30 minutes in front of the mirror, but yes, your liner, your BB cream, your kajal, that is that little things that if you enhance on your face will make you look more confident and more refreshing. And it's not only for how do you appear in front of others, but these things are very necessary for self motivation, for self enhancement. I would like to say it gives you a different power to go and rock the world if you are dressed well, if you're looking well. So this is very important. And yes, I would like to also tell few things like, yes, women can keep like few colors in their wardrobe so they don't get stuck what they have to wear each day. So for example, having black kurtis or black tops, having something in pastel colors really works. But these colors will never go out of fashion, and you have to make sure you wear a proper footwear which is comfortable as well as which goes with the attire you're wearing. For example, if I'm wearing a business suit, I have to make sure I have to wear a closed toe shoes and not the peep toe. So these are the few things. If you keep in mind and if you coordinate these things, you look uniformed. And yes, again, I would like to say a proper smelling good is really important. Like, this is how you also feel better about yourself. And when you all doctors, like, you meet so many patients and all, I think that little fragrance will really motivate you to take another patient, I would like to say. And yes, so these are the few things I have put it in a nutshell. And if you guys have any question, you can really ask me now. And yes, I'm like almost done.
Great, Snehal. Very nice presentation. Thank you so much for guiding us regarding this. So one more thing, would you like to tell us regarding more about how to take care of our hair in this rainy season?
Yes. So for most of the time in rainy season, the common problem is freezing of the hair because of the too much moisture in the air. So I prefer tying up hairstyles and using the serums for the hair. I don't say oil, but yes, there are many serums available in the market. So according to your hair type, you can get one. And I do prefer a tied up hairstyles in this season so that your hair is away from your face, and then you're avoiding those unnecessary acnes, because your hair will be like sticking to your skin all the time. And as you know, as the dermatologist, I don't remember, the ma'am told, like, it is very important how to take care of your skin as well. So this will help. So tying up hair will keep your skin better as well. Sorry, Doctor, I can't hear you. You're mute.
Yeah. Thank you so much, Snehal, for your lucid and informative talk, and very important aspect you have highlighted.
Thank you.
At the end of the session, we would like to address few questions from the audience to you. So,
Ma'am, but I won't be there. I'm so sorry. I need to catch up a flight. I have a shoot to go. So if we can interrupt now, and if I'll be more than happy to answer any
I'll
questions
just check in the chat box whether there are questions. Till that time, I would request Chirag to hand over the e-memento to Snehal.
Yeah, thank you, everyone. Thank you so much for having me. It was a great opportunity.
Thank you. Thank you so much.
Thank you so much.
Thank you, Snehal. So, there's a question regarding which perfume is best for males from Dr. Abhijit.
Come again. I can't hear you.
Yeah, Anshul, your voice is not audible.
So there's a question from Dr. Abhijit regarding which perfume is best for males.
So it depends upon the personal choice, because perfume is something which you have to smell it, because everybody's taste is different. So I would like to say, not going for not a very strong smell, but like smells like musk are good for men. They can really go with that, but it's really a personal choice, because a wrong perfume can give you a headache. So we have to make sure the perfume which we are used to that kind of a smell, and we are okay with the fragrance. Otherwise it can lead to a headache. So for men, you have to go and test few, but I would suggest one is called musk. And it comes in different brands, so basically you can go check few.
Very nice.
A minute. I'll check.
Ragini ma'am, there's one more question.
Yeah, please go ahead.
There's a question from anonymous someone asking that what if a person is allergic to perfume? What can they do to avoid the smell and to have what all the things they can resort to if they're allergic to perfumes?
Yeah, so there are few talc, talc powder, deodorant powders available in the market. We can use those. We can use the sweat pads under the clothing so that even it keeps you away from the wetness that is appeared on your clothes. So these are the few options that we can use, and also the kind of a material that we use. So people who sweat and who has a fear of smelling can use like cotton, linens, and avoid the material like silk or any kind of silk or satin materials. Basically, they can really go with the cottons and linens.
Great, very nice. Thank you for such insightful information. Thank you for joining us and making us more aware regarding our grooming and our makeup. Thank you.
Thank you so much. Thank you for having me.
Now coming to last but not the least of the presentations, I would like to invite Dr. Rupa Adatia, Director of Skin Wellness Center, situated in Ramdaspet, Ramdaspet area, to present her talks regarding very innovative and very recent advances of dermatology, having Botox, fillers, and all those stuffs which make us look more younger and more youthful. Over to you, Dr. Rupa Datia, ma'am.
Thank you, Anshul. Am I audible properly?
Yes, ma'am.
Yes, ma'am.
Okay, thank you. I would like to thank the organizations VDS, NOGS, and IMA for inviting me today. Without wasting the time, I would like to share my slide. Is it visible now?
Yeah, it is visible.
Okay, yeah. Thank you. I'm given the task of talking about anti-aging, and it is a huge topic. So I would try my level best to try to compact it in 10 to 15 minutes time, because anti-aging.
Madam, please slideshow.
Slideshow is not visible.
From beginning.
Yeah. I'm given this task of talking about anti-aging, and it's a huge topic. I'll try to cover it in as much time as possible. In 10 to 15 minutes time is too short, but I'll try to see how we can appear our level best. We have already learned whenever there are problems of acne or melasma or pigmentation, how to present yourself the best. But here, the august audience, I would like to throw some light on aging and anti-aging. To talk about anti-aging, let's start. What is aging exactly? And doctors being so busy, so they try to neglect themselves and neglect themselves. Most of us do, but it's not very difficult. And if we are updated about the latest things and prejuvenation, we can try to maintain ourselves and present our best self. What is aging? We divide the aging into broadly two groups, that is intrinsic, that is genetic senescence that comes with age. The skin cells, they can't perform normal functions. The skin thins, collagen and elastin lessen. This is we all know. What happens? The skin becomes dull, dry. Initially, there are fine wrinkles, and ultimately, there are deeper wrinkles that appear on the face. Because face is the most prominent part, we'll try to concentrate on the face, but otherwise, this aging process affects whole of the body, whole of the skin. Next is environmental aging or extrinsic aging. As skin is the most outermost shield of the body, and hence everything under the sun, and including the sun, damages the skin. It can be the pollutants or extremes of temperatures or your smoking or your environment. Everything affects and may hasten your aging. The most important, as Dr. Priyanka has already highlighted, sun is very important. And what we call it as the skin that is aged faster due to sun, we call it as photoaging. The sun exposed skin, that is the face and the neck, it shows more deterioration over time. And that is how we see cumulative effect. It's not that like I'm not going, I used to go out in sun in my PG days, but now I'm not going, but still there is damage, my skin does not look good. That is a common question that doctors at times ask. But it is not just now that affects your skin and the aging, it is a cumulative effect of the sun that shows on your skin basically. So earlier the better. You must start protecting yourself from sun exposure. The earlier the better. This is how face ages. We'll try to concentrate on the face. As there is loss of collagen and elasticity, the skin becomes less plump. There are fine wrinkles that are visible on the skin, and later with continuous expressions, there are some permanent lines, what we call it as the nasolabial fold, the crow's feet. These appear over a period of time under the influence of gravitation, loss of collagen, and effect of sun exposure. These are the things that we actually see and what we call it as aging. These are what we call it as forehead lines. Those who tend to frown a lot, they develop this frown lines. So what we recommend, what I recommend my patients, if you are traveling a lot in the sun, try to wear some sun glares so that you don't frown. Because of sun also you tend to frown a lot. You don't realize you're using these muscles continuously, and that is how you tend to start developing these lines. So that way, expressing the same thing again and again over the years, you tend to develop these deeper lines. Apart from, it's not just the lines that show your age. Initially in the youth, the cheeks are mostly full, but over a period of time, they sag behind. The fat that was here initially tends to sag behind and forms this jowl. So there is hollowing of the mid face, but there is development of these jowls causing the nasolabial folds. Because of the fat that is descended here, there is development of nasolabial folds. The jaw contours, you can't make out the jaw now. The jaw is not visible. These are the nasolabial folds, marionette lines, and chin wrinkles. These whole give us the impression of the aged face. And this is how actually we see in our Indian skin as aging. These are the forehead lines, frown lines. There is loss of forehead volume. If you see closely, there is hollowing of the forehead. Also, there is the chin is not defined, nasolabial folds are there, marionette lines. Here, I would like to emphasize we are luckier from our Caucasian counterparts because of our melanin, that melanin that we don't like actually, it protects us from photoaging. It acts as a barrier and hence it protects the collagen. But still, what we see in Indian patients is more of patchiness, more of dryness, uneven tone, pigmentation. That these are also signs of aging. As I have to emphasize on contouring, let's see what actually happens. During the course of aging, the general outline of the face changes. In the youth, if you see the outline of the youngsters, it is an inverted V with the V pointing. As one ages, the jowls form, it becomes a trapezoid or a rectangle, and that is how we see the changes of the aging. This becomes broader, basically the base becomes broader. This is what we try to correct it. If we really want to do some anti-aging in a real sense, this is what we try to correct. The inversion of beauty. For achieving all this, if you see here, so this is inverted triangle and this has become trapezoid. These are very visible, especially in female faces. Coming to anti-aging, to look, as we have heard so much, it's a universal human obsession. But what we try to do is we want to appear our best. We don't want to change. We don't want to be somebody else. But whatever we are, we must present our best. That is what Asim sir also told us. That is what all the speakers told us. It is just what you are. You be yourself, but your best self. To start with, for the doctors, I would like to, anti-aging does not come very cheap. Anti-aging does not come very easily. It's not just a visit to the dermatologist that anti-aging works wonders. You have to pay attention to your medical fitness, both physical as well as mental. And we all know the doctors neglect their health so much so. And that is how they appear aged compared to their friends. If we see, they appear older because of the stress, because of the neglect. So do book your yearly body checkups, control your medical issues, whatever it may be, regularize your lifestyle. That is very important. Respect your circadian rhythm, exercise, meditation, and restrict exposure to sunlight and blue light. Try to use a sunscreen. These are the basic preventive steps, especially true for the doctors, because we tend to neglect these aspects. And it does not come in a bottle. Anti-aging does not come merely in a bottle. We have to follow these things. These aspects, exercise and diet and everything has been highlighted by the previous speakers. But coming to the skin, I would emphasize more of colored fruits, more of vegetables. That is really going to help us. I won't go into details. These have already been covered. Antioxidants, yes, the sun causes oxidative damage. The blue light emitted from your laptops, the lights, it causes oxidative damage. To counteract that, we have to take antioxidants in your diet or maybe in supplements. That is vitamin A, C, E, beta carotenes, and there is endless list of antioxidants available. These actually, they combat the free radicals. Otherwise, these free radicals, what they do, they tend to damage your skin protein. So these antioxidants try to combat the damage. So that is a must in your diet. Now this concept has come of rejuvenation. I was supposed to talk on rejuvenation, but now we concentrate on rejuvenation. That is the prevent the loss of youth. It's not just that you've lost and now you are aware that no, these lines are visible, now this is visible. It's better you start early, what we call it as preventive rejuvenation or prejuvenation, basically. So the things, little things like using a moisturizer or retinol or vitamin C or a sunscreen regularly from your early 20s that help in preventing your youth, in maintaining your youth. And many a times people who are in some flashy industries, they start preventive doses of Botox or fillers early on to maintain the plumpness and prevent the lines. The basic therapy that the basic treatment for anti-aging we start with is a good moisturizer, because as you age, your skin tends to become drier. The skin is drier, it tends to become damaged easily by sun or by, so normal barrier has to be restored. It depends on what kind of skin you have. If you have little oily skin, try to use lotions. If you have dry skin, you can use olive oil or moisturizers with shea butter or ceramides or squalene. It basically depends on what kind of skin you have, but it is a must. Immediately after skin cleansing or toner, apply a moisturizer. Next is a magic in a potion is retinoids. It is available as tretinoin or retinol. It is also available in OTC products. Retinol is available in OTC products. Most of the common brands that we get, Olay and everything, everybody has, most of the anti-aging creams has retinol. But the concentration varies basically in cosmetic industry that does not reveal the concentration. So that is why we generally advocate to use products that come under medical this thing. It protects the skin from damaging effects of UVA, prevents the collagen loss, and stimulates formation. That is how it acts as anti-aging. It reduces the fine wrinkles, hyperpigmentation, and improves the pore size and roughness of the skin. So it is a basic thing. We generally advocate to use retinoids at night time, unless very low dose of retinol. We generally advocate it to use at night time. But those with dry skin need to check with your dermatologist, because it tends to dry up as it exfoliates the dead skin. But otherwise, it's a magic formula. The new hype these days is vitamin C. It also boosts collagen production, reduces pigmentation, reduces fine lines and wrinkles, and thereby maintaining the skin youth and the plumpness of the skin. So it also comes in prejuvenation, or what we call it as preventive health of the skin. Sunscreen has already been highlighted by Dr. Priyanka Mangya, so I won't go into the details. It must be used throughout the year. Now coming to the latest things what are available, and we are already bombarded with so many things, muscle relaxants and dermal fillers and peels and what exactly we should go with. I'll try to highlight what new we are doing, what you can do for yourself, or at least you can advise your patients. The rejuvenation part is incomplete without the use of lasers and light. There are various lasers, different lasers for different indications. It's not just one laser that is going to do a magic. We have invasive lasers like fractional CO2 laser or erbium YAG lasers, and non-invasive lasers like Nd:YAG, IPL. Both of them, invasively or non-invasively, what it does, the beam goes into the dermis, stimulates collagen formation, fibroblast formation. They increases elastin formation, and thereby giving a plump skin and reduces the wrinkles. There are various newer devices like microneedle RF, that is colorblind, and HIFU. HIFU is high intensity focused ultrasound. It targets the adipocytes as well, and leads to skin tightening. Here we use high intensity focused ultrasound, so it precisely applies this energy to locally heat and destroy the fat cells and tightens the skin. This is non-invasive. Again, it is non-invasive, it's comfortable and rewarding. These are some of the results. Next is radio frequency. Multipolar radio frequency devices with or without microneedling are available. It also leads to collagen stimulation, elastin, but these radio frequency and HIFU, you need to do more number of sittings, like once in a month or once in 2 months, depending on the status of the skin. But it definitely promises a good youthful skin. Next is cryolipolysis. Those with redundant fat or double chin, what we call it as, this cryolipolysis and injection lipolysis. It destroys it. Injection lipolysis basically contains deoxycholic acid that destroys the adipocytes, and thereby contouring means you have to remove what is excess and fill up where there is deficiency. That is how we try to contour the face. So for the heavy ones, for heavy chins, we try to contour with injection lipolysis or cryolipolysis. Next is platelet-rich plasma. It has been used since quite some time. It's really a very good thing. What we do is we take the patient's blood, concentrated platelets, which is a rich source of growth factors, are used for skin rejuvenation. These growth factors help to regenerate new tissue, that stimulates fibroblast formation and collagen. Again, it is your own blood. It is quite safe. No chances of allergy, no chances of anaphylaxis. So it is quite safe. And when used over a period of time, though the collagen formation itself takes time, once you do a procedure, collagen formation may take somewhere around 2 to 3 months after a certain number of sittings. So, but over a period of time, there is reduction in wrinkles, folds, lines, elimination, and at least it gives rejuvenation. And it's quite safe a procedure, a quicker procedure. We generally tend to target face, hands. That's really good. Next in the armamentarium is a thread lift. It procedure that lifts and realigns the sagging tissue, sagging skin, and thereby, as I told you, the jowls are there, the nasolabial folds are there. So to reduce that, we have this thread lift procedure. Threads are basically suture materials. We have it simple suture materials, or we have curved threads, twisted threads. We generally insert the needle with the thread, remove the needle back basically in these directions. The thread remains, it gets absorbed over a period of time. It acts as a foreign material, leads to collagen synthesis, and in the long term leads to anti-aging effects. It gives very good results, but again, as I told, it takes time. So if we start now, it takes at least 3 to 4 months for the results to be visible. These are actual patients. Now coming to the ultimate anti-wrinkle therapy with purified protein, I should not have highlighted the brand name, but everybody knows it so well in the name of Botox. Effects are seen in 3 to 4 days. The effect lasts 4 to 6 months. For the lines is a wonder drug for expression lines. See, basically it relaxes the muscles. So when the muscles are relaxed, the lines that are formed due to action of the facial muscles, it obviously relaxes. But over a period of time, over a period of 4 to 6 months, there are new neuromuscular junctions that come back again, and hence the effect goes away. So effect lasts for somewhere 4 to 6 months. It helps the neck bends, eyebrow shaping, jaw definition, and also it helps excessive sweating, or what we call it as hyperhidrosis as well. Those with excessive hyperhidrosis, Botox also helps. This is one of the patients. Next is injectable fillers. What generally there are numerous fillers available, right from fat cells to permanent fillers, but generally we refer to fillers as injectable hyaluronic acid. As I told you, there are grooves developing, so this hyaluronic acid is generally present in the skin. We try to replenish, as over a period of time the hyaluronic acid reduces, so we try to replenish it, fill up the grooves, fill up the hollowness with this substance. It helps in reducing the dark circles. It lifts up the cheek, lips, and anywhere you can put it basically, and it's quite safe, and it has been used since almost 20-25 years. And the present day hyaluronic acid, they are very specific for the area that needs to be treated and gives very gratifying results. These are some of the results of injectable fillers. It is not a lot of changes that you see in Anushka Sharma, because they tend to inject a lot of things. We try to make subtle changes because we don't have to appear on the screens. It's just that you appear 5 years younger. It's just that you appear little fresher. To summarize, I would like to say sunscreen, moisturizer, vitamin C, antioxidants. Come to one point, what bothers you the most? It can be your pigmentation, start with that number one concern. It can be your lines, start anti-aging products. But if you start everything all together, it may irritate you and you will stop using. As such, somebody who is not used to applying all the things, it's very difficult. So focus on one thing, try to reduce it, try using sunscreen regularly, vitamin C regularly, and then come to your concerns. No single product treats all signs of aging, and use the products according to the skin type. As Priyanka has already told, read the product labels. It should be hypoallergenic, non-comedogenic, depending on what kind of skin you have. Have realistic expectations. Anti-aging creams give modest results, to be honest, because there is a lot of problem in absorption. Like little amount is absorbed, little amount causes the effects. That is why our procedures like lasers that penetrates directly into the dermis, or our injectables that penetrates directly into the muscles, they give instant gratification. But yes, to begin with, anti-aging creams, they do give results, but one must have realistic expectations. It does not give a lift. And pricey always does not mean excellent. Retinoids are available. We all know retinoid cream. It acts as an anti-aging cream. Use it once in a week or twice in a week, depending on what kind of skin you have. Use a good mild moisturizer. Use a good sunscreen. That is sufficient enough. It's not necessary you have to go to the airport and buy the most expensive anti-aging cream. And you can't neglect, you can't say procedures are an integral part of the skincare in today's era. I think I have summarized most of the things, but I would like to conclude, aging is universal. Nobody is spared. So don't expect you will be spared, but let's try to make it more graceful. Thank you for patient listening.
Thank you, ma'am. Thank you for the wonderful talk. It was very enlightening.
It
Am
was
I
my
audible?
pleasure, Anshu. Yeah, it was my pleasure, Anshu.
Yeah. So I would like to go with the question. Ragini, ma'am,
Yes, yes.
is it a memento presentation or should we
Yeah,
proceed with?
yeah. We will present a memento first. I would request to present memento to Dr. Rupa Artia. Thank you so much, Dr. Rupa, madam.
Thank you, ma'am. It was my pleasure being among the August audience.
Yeah. It was very informative and we learned a lot from your talk. Now, I would also request Chirag to hand over the mementos to Dr. Shirbhate, sir, President, Vidarbha Dermatology Society. Sir, are you there? Thank you, Dr. Deepak, sir. And Dr. Alka Mukherjee, President, Nagpur Obstetric Gynec Society. Hand over the e-memento to Dr. Alka Mukherjee. I think she has left. Thank you. Over to you, Dr. Anshul.
Yeah. So now coming to questions, Rupa ma'am. Hello.
Ma'am, you are not completely audible.
Am I audible now?
Yes.
Yeah. So, ma'am, there's a question regarding which brand of sunscreen is best suited. So, could you please enlighten regarding this?
See, basically, brands as such does not matter. What matters is you use it regularly in adequate amount. Most of the medicated sunscreens, like what commonly we get, the Photostable or Suncross or the common brands that we have for Indian skin type, SPF 20 to SPF 25 is sufficient enough. You don't need to go for higher number. It becomes really expensive and you don't need it. Tends to become little oily also. So unless you're going to some beaches or high altitudes, then you require a higher SPF of sunscreen. In day-to-day lifestyle, SPF 25 is sufficient for our Indian skin type, but it should be applied properly in sufficient amount, 20 minutes, 30 minutes before you step out, and should be used regularly throughout the year, irrespective of the weather. So that is very important.
Yeah, that is very true. Regarding that, a SPF of minimum 30 is also a thing which should be to be looked upon. And with the sunlight type of sunlight we are having, it is better if we have a PA 3 plus rating to be looked upon while buying a sunscreen. Ma'am, coming to another question, there's a question regarding what is the dose of zinc and ascorbic acid used for melasma. Is Priyanka there? I would like to have Priyanka to answer this question.
Yeah.
Dr. Priyanka.
Yeah. For in case of ascorbic acid or vitamin C is commonly known as, for oral doses it's 500 mg BD or 1 gram. And for zinc, I think it is 100 mg. It's sufficient because 150 and above is used as an immunomodulator, So 50 to 100 mg of zinc and 1 gram of oral vitamin C is sufficient.
Yeah, that is true. And we do have some different vitamin C if we are taking, if we are applying it also, then also it gives very good results, as Dr. Rupa said. So now there's another question regarding for Snehal Giritkar, but I think she's not there. So
Yeah, she is
could
not there.
yeah. So the question is regarding how to choose the attire and collaborate it with the good jewelry when we are coming to the Indian outfit. So anyone from the speakers could like to throw a light on this? Rupa ma'am, Priyanka.
What was the question?
The question is how to combine the attire and the coordinated jewelry for the Indian outfit.
I believe in simplistic things. It's better, the smaller, the better. That is what I believe in. So, and it goes with whatever the outfit you had. Let it be your Western outfit or your Indian attire, as at least for the clinics, it suffices. A small solitaire or a small pendant with your tops, it's sufficient.
Yeah, true. So regarding the Indian outfit, the best is to combine it with whatever simple jewelry we are having. We usually wear very simple,
Anshul, please use
minimalistic.
mic. Your voice is clear.
So for the Indian attire, it is very simple. Am I audible?
Yes.
To pair us with a very minimalistic pendant and earring set, and if we are going for a certain function, then we can pair it with a colored jewelry, same colored jewelry as that of our sari or Indian outfit. That will help in the coordinated look, along with a purse or matching footwears to add on to the things that ways. What are your thoughts, Sushma ma'am?
Sushma ma'am?
Yes, yes. What was the question? Sorry, I could not hear.
Ma'am, the question is how to select and coordinate the jewelry and the attire for Indian attire.
I think you have asked very wrong question to me. Because I'm very simple and I am not all this. I have not tried all this. So I think anybody else can answer this question.
I think it is by everyone's choice. This is what I feel. Few people, they feel love to be just simply dressed without any additional jewelry. This is what is my take.
Yeah, great, ma'am, great.
Dr. Anshul, if the questions are done with, should we end with the CME?
Yeah, ma'am, we are done with the questions. One thing would I would like to ask Rupa ma'am.
Is she there?
Yeah, yeah.
Kind of
Not audible, I suppose.
Yeah, she's not audible.
Hello,
Doctor,
am I audible now?
now you're audible.
Yeah. So
Again, your voice is breaking.
for someone who is allergic to retinols.
Your half of the question we could not hear.
Yeah. So what would be the approach to for a daily routine to a patient who is allergic to retinols?
See, basically, what happens if many times it's a complex thing, as we all know, The skin tends to become dry, and that is why somebody tends to become retinoids. Generally, retinoids, tretinoin, if it is used, it tends to irritate more. If retinol is used, as it is present in most of the anti-aging things, generally people tolerate it well, provided you use a proper face wash or a cleanser that is really mild. And you can just start with a moisturizer, and in the evening you can use a vitamin C topical formula. Over a period of time, when the skin becomes normal, the dryness is reduced, the epidermal barrier is restored, then maybe you can try to introduce retinol in a low concentration once in a week, and maybe that would suffice. And it's not necessary everybody has to use retinoid. It does not suit you. Vitamin C serves the purpose equally well, but provided you use it regularly. There are various other options available as an anti-aging, but it depends on what kind of skin you have. This is the basic retinols I added because it is known to most of the doctors. That is why, and it's commonly easily available. We have a range of alpha hydroxy acids available, glycolic available in most of the topical preparations that acts as an anti-aging. So instead of retinoids, we can replace it with alpha hydroxy acids.
Yeah, thank you. Thank you, ma'am, for enlightening us. Now, Ragini ma'am, I would like to conclude the CME.
Yeah. Thank you, Dr. Anshul, for chairing the CME so well. Half of my job you did, so I should thank you personally for that. And I thank all the speakers, chairperson, all the president NOGS, president PDS, and also the delegates, audience, and DigiShield people for conducting and attending in so large numbers. Thank you, everyone. Now we should end this CME. Thank you.
Before that, please present the e-memento to Dr.
Yeah. Now I request Chirag to present e-memento to our chairperson, Dr. Anshul.
Yeah, Dr. Anshul, please accept the e-memento.
Yeah, thank you. बोल.
Hello.
झालं.
Thank you, ma'am. Thank you so much. Thank you.
Thank you, Dr. Anshul.
Thank you, Dr. Anshul. Thank you, everyone. And see you in next CME when we conduct again dermatology related CME.
Yes.
Thank you.
Thank you, everyone.
Okay.
Thank you
to everyone.
Thank you, ma'am. We are officially ending the webinar here.
Yes, Chirag.